And I'm holding off because I'm getting a message that says recording pending. Okay, now we're recording. All right, let me introduce Gary. It is my pleasure to introduce UVM Extension Assistant Professor Gary Deziel. You've heard many of his credentials mentioned yesterday in his introduction, and you can find them on our webpage. But I really wanted to mention that Gary is a valued collaborator to us at the Vermont State Library and serves as a resource to the Vermont library community as a whole, and we really appreciate that. Gary generously shares his expertise in finance and operations, as well as human resources, with us regularly in sessions and uh, web resources that he makes available to us. And he can relate his skills to the work of library trustees very closely, as he himself is a trustee and treasurer of the Georgia Vermont Public Library. So Gary, take it away.
Thank you, Jeanette. Can you see my first slide?
Yes.
Oh, good. So I did it correctly. So thank you, everybody, for joining this morning. And see if I can forward this slide. Here we go. I just wanted to say thank you to the Vermont Department of Libraries and these fine people that are listed there, Jeanette, Joy, and Laura, in alphabetical order. Just really appreciate working with these fine folks and love working with libraries generally. And as Jeanette said, I'm a trustee and treasurer of the Georgia Public Library, and understand a little bit about what trustees are facing during these COVID-19 times and regular times, and hope to share with you and friends who have joined the talk this morning a little bit about some HR. So we'll get right into the learning objectives. I've got about 30 slides, so if you're counting down the slides, then you have your own objective to get to. But what I wanted to get through or try to the objectives I wanted to reach was that you appreciate that the values of your library and yourself underpin everything. Recognize your importance as a trustee, especially as a trustee during these times. Understand that people management basics continue in full force, and there are some new basics too that COVID has introduced an opportunity for us to learn new things about how to manage people as best we can, and then gain a little bit of a knowledge about the laws and regulations that affect employer and employee rights and responsibilities as you try to successfully run your library. So when we talk about human resource management, people management, this is something that it kind of boils down to. It's complicated, as you know, people being people. And I like this picture because it's actually not very complicated for this guy, because this guy, he looks like he's delivering something, and there's no traffic. There's a 6-way stop. There's no traffic, and he's got Google Maps, so he's probably not even paying attention. But it is complicated when you're working with people. There's the people side of things, the emotional side of things, and then there's laws and regulations on what you need to know to help guide you through things. So we'll talk about all those sorts of different things, at least touch upon those things. And I'm taking this slide from Laura, a presentation that she gives on trainings to trustees, and I think it's really important slide. It's about the well-being of the library. The trustees are the boss. In an incorporated library, of course, you are the board of trustees, the board for running the corporation. And as you probably know, as we all know, is that trustees have special and kind of exceptional rights and responsibilities within town governance. When I talk about the well-being of the library, this means serving customers, but it also means, of course, serving your staff as best you can. Because in any organization, and it's a truism, you've heard it before, is that your people are your most important asset. And so the well-being of the library relies on the well-being of the staff and the well-being of all that together, is what your goal is. A little segue into what we know about mental health. This is from a webinar from the Society for Human Resource Management that I attended in August. You can see some of the statistics here, I hope, on your screen. 72% of Americans say their life has been disrupted. That's not something that's surprising. Women have reported higher um, uh, uh, disruption than men, and 1/5 of people say COVID-19 has had a major impact on their mental health. And even if you back up before COVID-19, mental health was a pretty significant issue in the U.S. and globally. In addition to these numbers, 90% of people say that they are worried about somebody they care for, somebody in their lives. It could be a parent, could be a child, it could be somebody in their household or that they're close to, that they worry about the effects of the pandemic on them. So, as you know, in the backdrop of all this is this tremendous disruption and tremendous angst, worry about what's going on. I consider myself fortunate because I had a daughter that just graduated from college. There was a lot that she lost in spring, no graduation. A lot of things didn't happen, but she is out of school, and I feel very empathetic towards those with children in school trying to manage a career, trying to manage all these things while so much is up in the air. So before anything, that I wanted to talk about these two things: community and commitment. Excuse me, community and communication. Um, what people really are looking for right now, and the really important thing to keep in mind in every action that we do when managing others, is the community and the communication. I'm very fortunate. In part of my job, I work for a grant, and in that grant has it's a small community. There's about 12 employees, but we have very good leadership. We have a meeting every Wednesday morning, which I had to duck out of actually, but Wednesday morning, and we do not talk about work during that meeting. We actually have staff meetings where we have that are oriented towards work, but we talk about just personal things like what we did this past weekend, things that are bright spots in everybody's life. This morning, it did devolve into some work before I left, because sometimes you just have to talk about work. But these leaders understood that, and they started this right after everybody moved home, right after the pandemic started. It's about community. People need community. They need those connections. And going to communication, that and I can't stress this enough, is that, and I'll come back to this, is communication right now is so important. It's more important than ever. So we are actually recommending people to over communicate to their staff. And we'll touch upon that a little bit later in this presentation. But just think of these two C's, C squared: community and communication is very important at this time. Now, I understand that as a group, and I don't know how many are signed in now because I can't quite see that when I'm doing a presentation, the numbers. But I know that a lot of you are bringing with you a lot of experience. Perhaps some of you have been managers, some of you have managed employees, worked with large organizations, small organizations. So you understand this, and a lot of it is going to be, oh, right, it's a reminder. But hopefully this will help you refocus into some of the things that are really important right now. As
Gary,
trust,
we have
yes,
20 participants, just so
20
you know.
participants.
Yeah.
Good. Thank you very much, Jeanette. So I've got this picture up, and I'm thinking of it as a path, and you can see there's a handrail there. And I think that's one of the roles that we have as trustees right now, is to give guidance to our directors, and so that our directors can support their employees. Um, and a place that it gives them some routine, some ability to plan, some direction. So we can't overemphasize enough the communication that's important right now, and some of those other aspects of good sound management that help us guide those library directors and our library forward. So think of yourself as you're really an important player in this. And I know that when I speak to my director, and I've been trying to call more regularly than I would have in the past, it's really important to touch bases because this is all new, as you know, and we just feel safer, more cared for, and just psychologically more safe if we have that connection. We know that we're kind of following a plan, getting into a routine, and moving forward. So I can't say enough how important it is for trustees to be engaged at this time and act as a guide, a handrail in this whole effort moving forward. So there are some new COVID basics. So I'm going to be talking about some basics after this, but here's some new COVID basics that I'd like to really emphasize. Over communication. Um, as I mentioned, my grant that I'm working on, we're meeting every Wednesday. And this really helps build the team. It's just incredible what difference it made because all of a sudden we were just scattered to the four winds, and over communication right now, keeping people up to date, being transparent as you can be is really important. Don't neglect key managers. And when I talk about key manager, I'm really talking about the director. Um, Supporting the director with the resources, making sure that they have what they need, like, the wipes and the plexiglass and the stickers for the floor, to keep people in the right direction and people at 6 foot distance. So providing resources, paying attention to them, communicating them to them right now is very important. Just as you would recommend connecting to a director, suggesting supporting their communication with their staff and with volunteers. And thinking of volunteers as sort of unpaid staff, they need to be involved as well. Um, Empathy and care. This is really important right now. Some people are at wit's end about what's happening. And just to feel safer and more secure, to feel that they're wanted. Empathy is very important. And I think for most of you, just knowing the library community, I think that we're doing pretty well on this, but to be deliberate about it and to be thoughtful about how you do this is really important. There is some research that's just come out again from the Society of Human Resource Management is that worker engagement is dropping, and really it's about connecting to that director, connecting to the middle manager, and making sure that they have the things they want, they know they're doing the right things, and that you're there. Routines and planning matter. Um, so we've been very meticulous at Georgia Public Library in planning out our opening sequence, creating new routines about window service, about what we're doing, how we're opening the stacks, those sorts of things. So plans matter, and routines matter. And the director knowing that you support that plan is very important, and working together. Professional development. We don't think very often of this. Maybe it's in their background. All right. Professional development. I mean, you're here today because you want to learn something new, something different. Right now is really a good time for professional development. Like there's so many things that we're doing for instance, virtually story times and things like that. It's an opportunity, and there's a lot of resources out there on how to do things better. So supporting your staff in developing themselves professionally it's a really good opportunity right now to think carefully about professional development. Going back to the big picture, and talking about your library's mission and values. This is, of course, what is guiding you, right? Your values guide you, how you treat people, how you communicate to the community, how you treat employees. These are essential values to your library, and the mission, what you want to complete. Now, perhaps your mission has changed a little in the last few months and it's been modified, but we're still open for business. And keeping your values in mind and mission is always important, as well as your strategic plan. Behavior is modeled from the top. That's something that I like to say occasionally. And you can just imagine how you can actually see in the United States how that is so important. If somebody at the top doesn't wear a mask, if someone at the top doesn't do something to protect public health, then followers follow. So modeling is really important, and advocacy. You've heard a lot about advocacy from the staff in Department of Vermont Department of Libraries, and advocacy is so important in supporting your director or the employees at the library. Um, we speak with, for instance, I'm talking about our board of trustees, speak with the town administrator and select board on a regular basis to advocate for some things. And now is no different, especially as we're approaching a time where our town is asking for a budget. And that's important to keep up those lines of communication. Okay, going into the basics, this is just the basics don't change. Job descriptions are important so that people know what is expected of them. And of course, job descriptions change over time. So if you've got out-of-date job descriptions, it's helpful to touch bases occasionally with that job description to make sure it's up to date. Um, Formal check-ins. I mentioned that we're meeting with my peers. We're meeting on a weekly basis, but I also have formal check-ins with my supervisor. Even though I might talk to my supervisor more often than that, formal check-ins on goals are very important, and annual evaluations are important, just to make sure that people are, on track. They're meeting the goals. They know where they stand. So that's very important. A few other things about the basics. And so we're getting in a little bit more into the meat of HR, and I hopefully will get through these slides so that we'll have maybe 15 minutes to ask and answer questions. But Vermont is an at-will state. So what that means is that in the purest sense, that an employer may terminate an employee at will. Regard There's doesn't have to be a cause, there doesn't have to be a reason. Now, that said, you know that all organizations, and especially if you are a part of a municipality, there are rules around how you behave as an employer. And there's also there's ethics too about how you really need to help employees succeed. When you think about progressive discipline, like, oh, we've got to talk to this employee, oh, we've got to write something down to help them, guide them to be successful. We have to create a small MOU so that they can reach deliverables or steps if they're in trouble. All this is meant to, of course, first to help the employees succeed. Um, and that's very important. Now, some of you may be working for a library with a collective bargaining agreement, a union, and so you'll have your own total set of rules about that. When we're talking about COVID-19 and about all the things that can happen with regard to employees, just remember that medical records are strictly private. According to the Americans with Disabilities Act, they are required legally. Any medical record is separate from a personnel file. Personnel files, of course, have to be under lock and key. They can really be only accessed by people with a need to know, and medical records are even more private than that. I was in charge of HR. I had an HR person that reported to me that ran the nuts and bolts of it, but in charge or responsible for HR for UVM Extension, about 180 employees. And there were things that my employee could not tell me about her conversations with others because it really didn't matter if I knew or didn't know because what mattered was what my employee told me about what might we do about accommodations, etc. So those are very important to keep in mind the confidentiality of medical records. Um, and as you're facing different challenges, inform yourself as best you can. And I have to admit, I took this line from Jeanette, who we gave a co-presentation about a couple months ago now, I suppose. And I like this line because um, when you're facing something that is a challenge, always try to learn as much as you can about your rights and responsibilities, whether you be the employer, the trustee, or the employee. An important thing, and this goes with engagement, it goes back to communication. So if there is something that you're facing as a HR challenge, it's an interactive process, and don't make assumptions. And I'll touch upon this a little in the future about, say, age. So like you're thinking about, oh, this person is older, this volunteer is older. I mean, what do I do? So don't make assumptions just because the person perhaps is older as your perception, as you see it, but what do they want? And make it an interactive assessment. Consistency is really important in managing people because you will quickly find yourself, and you probably know this, quickly find yourself in trouble when you make decisions kind of arbitrarily. Okay, this person gets this, and this person gets something different because, well, it's just what I decided. But consistency is really important, and it's especially important when communicating about COVID-19. Um, and I'll get again that we have a slide coming up where I talk a little bit about that. Documentation in HR, of course, it's document, document, document. Just like in real estate, it's location, location, location. So you want to document what you decided, why you decided it, share it with the employee, and put it in the personnel file. That's why these periodic formal meetings with employees are so important because you can document things. Remember also that like an annual review, there should be no surprises. There should never be a surprise at an annual evaluation. People should know how they're doing, what needs to be improved, and where they're like stars at. So that's important to document. Consistency. And I put this in here just this morning. I was thinking overnight, I don't know why I was thinking about courage. And it's because when you're managing people, um, when you're working with people, when you're making decisions, it takes courage because, and sometimes I think back on my previous experience as a supervisor. There's points in my previous career that I've had up to 25 people reporting to me. Luckily, when I don't have anybody reporting to me right now, but my last job I only had about 4 or 5, so that was very doable. But I see places where I really didn't have courage, and courage just means like just be I should have been more straight with people about things that I didn't think were really meeting the mark. And so when you're managing people and you've got a responsibility for how the library runs, sometimes it takes courage. And right now, it takes a lot of courage too, because there are so many issues that you have to deal with. You've got customers on one side, you've got the town governance on the other, the town administrator or others saying like, why aren't you open like the highway department? Um, so it takes courage to uh, manage people. And who knew the trustees had so much responsibility? When I just wanted to see my name on the ballot. but it takes a lot of courage to do this work. So kudos to you. Um, and also know when to ask for help. We've got such tremendous resources to help us support this. You can add my name to here, and you'll see my email address in the last slide. But Vermont Department of Libraries has a wonderful staff, just really, really knowledgeable staff who can guide you on any sort of question that you have. You get Joy and Laura, Jeanette. There's a host of people there. Um, so I have trustees in here. I should have edited this. Sorry. Trustees, of course, are yourselves, and in together you have that power to communicate and to bounce ideas off of. Our chair of our trustees is a school psychologist, and she's really, really articulate. She is really, really thoughtful. I, on the other hand, have some background in budgeting, budget management, HR management, and like we work together very well. And we have another trustee on our board is like a Robert's Rules of Order expert. She keeps us out of a lot of trouble. So it's great to have those colleagues that you're working with. If you are a municipal library, you have the Vermont League of Cities and Towns to rely on through your town. They have HR attorneys on staff, which can be very helpful. And they have things like employee assistance programs available through VLCT, through the municipality. And as I understand it, every municipality is a member of VLCT. And of course, there's the attorney, either through the town or if you're an incorporated library through whoever you might have on a kind of a hopefully pro bono basis, but for hire as well. Just wanted to take a breath right now. Are there any questions, Jeanette, that have come up?
There are not so far.
Okay.
So everybody out there, please go ahead and type any questions into the chat box as they come up.
Okay. Thank you. So switching gears a little bit, I want to talk about laws and regulations now. And this is going to be a brief overview because there is so much documentation about laws and regulations. And on my final slide, which you won't see, I won't show it to you today, but it is a reference slide, and you'll see it when we share the slides. But there's some really good references, websites you can visit to answer some of your questions. But this, of course, the agency, ACCD is really guiding us right now in the state of Vermont, and they're talking about all nonprofit and government entities to encourage telework, right? And that we shall accommodate the needs of high-risk individuals when we can. So telework is good. It says when practical without impeding productivity. Now this worked for a time, didn't it, for libraries? But libraries are community places, community centers. There's places that people go to look for jobs on the computers, to look for information, to develop literacy about their world. So it's not really practical to continue telework for libraries as a place of community. So then we start talking about workers coming back to work and some of the laws and regulations that may come into play that you might, want to at least have some awareness about. And again, I know I'm talking to a crowd that may already have good knowledge about this, but if you haven't, here's a little bit of a cheat sheet. ADA, ADEA is about age. It's the Age Discrimination in Employment Act. VOSHA or OSHA, that's V is Vermont, OSHA is the Occupational Safety and Health Administration, that they're about safety at work. FFCRA is the Family First Coronavirus Response Act, which has to do with medical leave, extended medical leave and time off. That's in place until the end of December. And then a big one is the ADA, Americans with Disabilities Act. So let's take a look at that a little bit. Um, Workers' rights laws. Okay, so we got Age Discrimination in Employment Act. So this prohibits discrimination based on age. And it's, believe it or not, it's 40 or older. So there's certain things that we can't do based on age, and it actually allows us to do other things based on age. Um, and we're going to get into some situations soon here. I'll demonstrate some of this. OSHA and VOSHA, really it's about the conditions of work. Workers are entitled to safe working conditions. And if workers have a serious beef with what's going on, they can actually not show up to work, call up their local VOSHA person and make a complaint. Um, we, of course, are doing everything possible following the ACCD COVID rules as we open up our libraries. So this shouldn't be an issue, but it could be an issue. And you can think of examples where you walk into a business, no one is wearing masks, they're doing this and that. That's actually could be um, a risk of serious harm, and workers are entitled to be protected in those circumstances. Going to the Families First Coronavirus Response Act, it's a huge act. The Department of Labor has a web tool, sort of a question and answer. It's really, really pretty good. It's sort of like an artificial intelligence kind of thing that I suggest you visit if you want to take a look at that. But it requires certain employers to provide their employees with expanded Family and Medical Leave Act leave and paid sick leave for specified reasons. And I know that on camera, and you might not see this very big, but there are documents out there that describe this to quite some detail. Now, if you're a municipal public employee, you fall under this act. Not-for-profit corporations under 50 employees have the ability to opt out of this or to request being opted out. But so it gets pretty complicated. If you are faced with something like this, then an HR attorney or your municipal folks could be very helpful in this. Again, there's a web tool here, Department of Labor, that I suggest you take a look at if and when you have time. Going to the Americans with Disabilities Act, this is a big one, and it includes a requirement for accommodation, reasonable accommodation, and non-discrimination based on disability. Now, unfortunately, this law is 30 years old this year, and I just read a statistic the other day, unfortunately, that 1 million disabled workers have or not abled workers have lost their jobs in this coronavirus, which is a proportionally higher percentage of the regular public. So we have a lot to go on this, providing accommodation, but we do our best here in the University of Vermont and libraries. So reasonable accommodation. And there's also rules about what the employer can ask or request for medical examinations and inquiries. Now, a reasonable accommodation is when you change your work environment that allows that individual with a disability to have an equal opportunity to perform that job's functions, that essential function. So telework, for instance, is an example that if you have a medical condition that is determined to be, for instance, at higher risk with COVID-19, to higher risk to get sicker, more sick due to COVID-19, it could be a reasonable accommodation is telework. Now, however, if the accommodation results in significant difficulty or expense for the employer, an employer may claim an undue hardship. And see, this is where it takes so much courage and so much management in getting through this, because by far, the average library in Vermont is a small library. Many libraries have just 2 or 1 or 3 or 4 employees, and it's very difficult to get back up and running if you don't have all hands on board. So, but it does say that if an employer is not required to provide, but still must consider other accommodations. So you have to go all the way to the end of thinking about it to provide an accommodation. But if the employer cannot, then you get into a termination situation. So important to engage in interactive negotiation and to understand everything and to document everything that you're working with. It's interesting. I don't know if you read in the Vermont Digger this morning, for instance, the faculty union at University of Vermont and the union and the administration are at loggerheads. It's going into mediation. One of the things that is of concern is that the administration is saying faculty don't have the right to just change the modality of how they're teaching. Like if they're afraid that of COVID-19, they can't go in the middle of the semester from a hybrid model with some teaching in the classroom and online to all online. And if you look at the fine detail, of course, even though the ADA says, Agency for Commerce and Community Development says telework is what should really be considered first. ADA says that the business has a right to keep business going. And ultimately, unless that professor has medical reason to switch, going through the ADA process, the university is saying, no, you can't. You got to work. You got to come to work. So see this playing out in different ways. So I'm kind of get ahead of myself a little bit. The ADA prohibits inquiries or medical examinations unless they're job related. So if there's a reasonable belief that the employee's ability to perform the job will be impaired by the medical condition or pose a direct threat due to a medical condition, that is having COVID-19. That's why you can ask for a note saying that the employee is better. We can ask actually relate to COVID-19 for proof. So generally speaking, when you're working with an ADA situation, again, it's really about communicating, engaging with the employee, making sure you know everything there is to know, doing your best to make an accommodation, and just doing your best to be as flexible as possible. But the hard news is that the employer does have the right to terminate an employee if it just can't do business. So, okay, we're going to briefly start. We've got about 18 minutes left, and I want you to put in the chat your answer to these 2 questions. I've got a little timer up there. I hope you can see it. So put 1, Y for yes, N for no, and then 2, maybe do 1 first, and then 2, and poor Jeanette is going to have to try to track these down and give me a kind of an estimate, kind of an estimate of what
Got
you
it.
see in the chat. Aren't you lucky, Jeanette? I just sprung this on you.
I'll gauge the mood here. And we do have 2 questions in the chat too,
Okay,
FYI,
okay,
that
okay.
are relevant to this.
Okay, so why don't you give me the questions so that you can gauge the mood?
Well, I can't do both at the same time because
I mean,
counting and reading.
are too much. Okay,
Yes.
okay.
Okay, so we're
So
seeing, let me see. Well, we still have a little bit of time here. For question 1, we're seeing mostly no.
mostly
We
no.
have one dissent here, and two Two skews. Two skews evenly. I think yes,
Evenly?
no.
Yes, okay. Well, thank you, Jeanette. Would you
And
like
people are
to?
still submitting.
Oh, okay. Okay.
Yeah, I think we're still pretty even on item number 2.
Okay. This is a little segue in between the questions and the answers. I always like this one. What's less painful than an 8-minute survey? Pocket full of bees. That's one of my favorite. So when you get an opportunity, Jeanette, to
Yep,
move on to those questions,
to
we
the
can.
questions. Sure. We had a bit of a discussion. So Nancy asked, let me just scroll up to. So Nancy says, I have a question about the Families First Coronavirus Act and sick time. If an employee comes to work and has a fever or any other COVID style symptoms and is sent home but does not have COVID-19, is it correct that they cannot use the Families First Act sick time but need to use their own sick time? What about part-time employees who may not have sick time? It's question 1. Do you want to answer that first, or should I go to
I
question 2?
just do they have to be so hard, these questions?
I
The
know.
the Family First Coronavirus Response Act, of course, is about COVID-19. So it does specifically say sick leave is due to COVID-19, not another, disease, another flu or another cold or infection where you might get a fever and feel like you were better off not living. That answers that, I think. Part-time, I think we have to. I don't want to really answer that question because the detail is so fine on that. And
Mhm.
I would prefer if I could get back to Nancy on that in an email.
Yeah, and I think the question, because I had a similar answer for Nancy, but I think the question is really the person has to stay home because it- they have symptoms that are similar to COVID, and if it wasn't for COVID, they would come to work. They would have sniffles or a cough or something, but because they're answering yes on the health survey, it is kind of COVID related. So
It's a tricky one, isn't it?
it is a tricky one. But
Yeah,
yeah, it's I
but
I think it's really I had responded to Nancy that it's more of a, how would you handle this in normal times, because it really isn't COVID per se.
right. And people, I know that, I mean, I'm not going back to work in the foreseeable future. But I know with my wife who works at the hospital, people are very, very super sensitive about anybody coming in with anything. It's just like um, we've been to a restaurant twice in the last 2 months, last 6 months, and just the other day, my wife um, choked on some water while drinking water, and she had a coughing fit. And you can imagine like what a typhoid Mary she was in that restaurant,
Right.
stuffing
So
her
it's,
napkin in her mouth. So right, just
yeah, so that's tough. The second question is from Maura. A scenario: a staff member claims having a high-risk medical issue and working in the library is dangerous for their health and wants to work remote. However, their major job functions require they be on site. Any suggestions for working with that employee? What are the rights of the employee and the employer?
right. That goes right back to ADA.
Yep.
So, um, it's like a grocery store. It's like you're in the same situation. You're kind of like an essential worker. For that library to function, that person needs to be in place. I mean, the first thing that you do as an employer is make sure everything is in place. And I've got a slide that I'll just talk about that in coming up. But it's doing all those things that ACCD says that you need to do: the social distancing, the sanitizing, the plexiglass, the separation, of employees and customers, keeping everybody safe as possible. If it really is an accommodation that needs, then that, that gets it to another level. Is that, okay, what do we do? I mean, you've already said that you can't function with this person not being in physical in present, and that means that you do have the right to terminate if you've thought of everything else. But, you know, can this other person do another job, another role? Can it change a little bit? So you have to be really creative about what this person could do or how you could fill that need physically in your library, document everything, but it may come down to termination. Because the employee
And
has
Gary,
rights,
can
but the
you,
employer has rights too.
yeah. And the question was the person claims to have
Yes.
an illness. Can you talk really briefly about the doctor's note and the requirements and responsibilities there?
Yes, you can require a doctor's note to document this. Be very careful about, again, the confidentiality. Make sure this is all confidential. And if you're a municipal library, you might want to touch bases with you don't share any of the detail with the town administrator, but you should be able to access Vermont League Cities and Town. They have HR attorneys who are certified HR professionals as well. Um, but documentation, document what your decision is, the communication that you've had with the employee. Try to accommodate, but simply if you cannot accommodate, you've got the responsibility to run the library, and that's that's where this courage thing comes in. But having somebody to lean on that's an attorney would be very helpful as well.
Yeah, and there's some really great resources out there on what's a reasonable accommodation, especially during COVID, which I will try to find the link and post that here. If not, we will put it on the resource page as
Right,
well. Yeah,
and one of my references goes back to the U.S. Oh, I got the acronym here. Equal Employment Opportunity Commission, and they're the folks that run ADA compliance, and they've got a great question and answer document. In fact, I
yeah,
think Jeanette, you shared that with me once.
yeah. That's the one I was going to look
Okay.
for. So if you have that on your site, that's great.
Yep,
Good.
it's on the
And
last
then
slide.
Lauren also said she has experienced that this too, so I suspect it's about, people coming in with the sniffles or whatever, and would love to hear guidance as weather becomes worse and more bugs appear. I think we've kind of covered that, so in the interest of time, we should probably move on. Gary, what do you think?
Okay, yes. Yeah, because I've got
Okay.
a handful more slides, and I know that we've only got about 8 or 9 minutes left. So to answer those questions, may I require my 67-year-old employee? No, you can't. You can't make assumptions about how older workers or workers, you can't make any assumptions. And this would be an exclusionary action because you're making the assumption that this person is healthier if they work from home, where in fact, this person might be starved for interaction with their community. So you cannot make those assumptions. Excuse me. If an employee lives with someone who needs special protection, the people that said no have it right. The ADA does not require the employer to accommodate an employee who is living with someone at risk. However, it is recommended, of course, that the employer offer some flexibility, and they have to offer this to every employee um, to help protect them. Again, this is an unprecedented time. It's a very difficult time to help employees through this, and it's a difficult time to be a supervisor. It's a difficult time to manage a team. But this is the answer, with black and white about ADA. Poor performance has been a question. I won't read this to you right now. I just love this Dilbert with and the boss's name is actually pointy-headed boss, or PHB. But the employer doesn't have to continue telework. I've heard this, and this is becoming more of an issue as time goes on, is that like, oh, there's some performance issues. The manager has done their work with communication, with trying to support, but really the employee needs to be in place so that they have the structure that will help them be successful. So, employer doesn't have to continue telework. Um, Going back to the Age Discrimination in Employment Act, no accommodation is required for age, but it is not illegal to favor an older worker over a younger worker. So if an older worker would like to work at home, or there was an opportunity to be a hybrid, maybe telework, and then come in sometimes, then you do have the right um, to offer that older worker some flexibility that you don't offer to a worker under 40. Fear is a huge one that we've been dealing with. I'm sorry I'm going through this fairly fast because we've only got a few minutes left, but fear that you've heard probably over and over about people just afraid to come back or afraid to go to work. So what you have to do is you have to figure out, as a general, are they afraid of just COVID-19, or is it specific? Do they have diabetes? Do they have asthma? Do they have those things that CDC has said, if you get COVID-19, you're likely to be sicker because of these comorbidities? So in general, and you can see on the right hand of the slide, in order to reduce fear, general fear is all about training. It's about following ACCD rules and sanitation, hygiene, personal protective equipment, masks, engineering. We're putting plexiglass in front of of the of the counter, for instance, in between workers, in between computers, and distance. So with this, you can reduce fear. And if it's about a pre-existing condition, you can ask, as long as you ask all employees, and nothing specific, do you have a pre-existing condition? And then you enter into a discussion with that employee. So a mental health issue can be covered under ADA, of course. So again, it's just like trying to walk through a minefield sometimes, how you feel about this. It's just be as open as you can with communication, understand what needs to be confidential, and just try to use your best judgment with the information that you have, seeking help from others who can give it. And then there's this question comes up after vacation quarantine. We do know that if you visit one of these yellow or red counties, you have to quarantine. In fact, my daughter and I are waiting to hike in the Adirondacks high peaks. We can't go there now because she works where she has to report. I'm in quarantine, so I'm fine. But you know, at UVM, if you go into one of these counties and you come back, you can't go back to campus. You actually have to take unpaid leave or medical leave if you haven't. And then we're almost at the end. Thank you for sticking with me. Recap for success. Values. Remember always to keep your values in the forefront. Recognize how important you are to supporting the library director, to supporting the library for the well-being of the library. People management basics are really important to keep in mind. And even though it's complicated, the rights and responsibilities as guided by the various laws are very important for the employer and the employee. So thank you very much. I wanted to point your attention to my email address there if you wanted to send me an email to Stump the Chump. And Jeanette, do we have time for a question?
Yeah, I think think we do. So really quickly, Debbie asked in terms of question 1, the little quiz that you posed, does this apply to volunteers? And then there's another question that includes volunteers as well. You can require all employees or volunteers to work from home across the board, though. Yes. So those are the 2 questions.
You can, I think that following the ACCD rules and CDC, if you can do it, that's what you should be doing right now. That's why I'm in my basement, and I will be here at least until spring,
Hmm.
because I can work from home. So any business that can do it should do it.
Yeah.
Um, So, and going back to the volunteers, that's a really good question. At UVM, we consider volunteers as unpaid staff. So they have to follow the same procedures, the same policies, they have background checks, all that stuff. And we expect them to behave like they work for our organization because they represent our organization, and we treat them in a similar manner to employees. So yeah, consistency.
Yeah. Good. So we have 2 more minutes if there are any more questions.
These are always
Post
tough
them now.
questions in HR. Thanks, Jeanette, for being there.
Yeah, HR. Something to geek out about, right? So I think I really, Gary, I appreciated your comments about no surprises, and I think this applies particularly when we have a volunteer trustee board who isn't a library director's full-time manager or managing body, if you will. So the no surprise idea is really important when you have the trustees come together occasionally to talk about personnel issues. It's really important to address things right away with the director. And I know that can get lost sometimes when this isn't the trustee's full-time job or they're not really experienced with HR. So I appreciate that note about that, and also courage and having those very difficult conversations up front, because the longer you wait to have those conversations, the more difficult they will likely get. So Gary, do you have any parting comments?
I don't, Jeanette, other than thanking
Okay.
everybody again. And I mean, being a trustee is difficult because there's a lot of responsibility that you don't perhaps even understand until you get into the job. So
Yeah.
thanks a lot, and good luck to everybody. Thank you, Jeanette,
Yeah.
for moderating all this.
Yes, my pleasure. And trustees out there, you know, you can ask us for help, talk to our consultants, contact us if you need any help. And thank you for participating in today's session. And we hope to see you this evening for trivia starting at 5. We'll have a little fun. You can bring your wine.
Thank you, Jeanette. Thanks, everyone.
Thanks. Bye.